given that we're in a different situation here on the East Coast, when is it likely to be that our medical system goes, I don't want to say back to normal, but a new normal where it can handle the day in and day out medical issues?
I don't think our medical system across the United States is ever going to go back completely to normal. I think we're going to see a lot of major changes in the way that healthcare is delivered across the United States. But I'll say that even here on the East Coast, we are ready and prepared to take care of those life-threatening emergencies that we're used to seeing come through the doors of our ER, whether it is chest pain or belly pain or severe headaches. I've said before on this show and elsewhere, use telehealth or call your doctor first before showing up in the ER. But as Dr. Austin said, if you are worried that you're having an emergency, we are ready and prepared, and we have ways to try to keep you safe, even in the emergency department. Now, we may not have as many resources as we normally would, but there is space, and we do have methods to take care of people. So the other thing I'll add there is that the social distancing helps because it decreases the number of traumas that we're seeing. So we're seeing fewer motor vehicle crashes and similar things that happen when people are kind of out and about. So there is space for those emergencies, and I urge people to come in if they're sick.
Dr. Randi, I'm going to take the bait here. You said something, and I have a little bit of time, so I'm going to ask. You said you think we're going to change the way we deliver medicine. That it sounds like you think there's going to be enough lessons learned out of all of this that we could actually change the way we do healthcare in this country. What are you thinking?
I think we're going to have to change the way that we do healthcare. Listen, because of those decreased volumes in hospitals across the country, hospitals are experiencing enormous financial strain. Every hospital and clinic is putting everything they have into preparation for COVID-19, while overall volume is going down. Right? And the government, I know the Democratic senators today proposed a new bill which is going to help prop up healthcare systems, but we're going to see a lot of clinics and hospitals shutting their doors. I think we're also going to see increased cooperation, data sharing, and hopefully a change in the way that we deliver care to our underserved and vulnerable populations and the way that we prepare so that we don't get caught empty-handed in the next pandemic or national emergency. So I know there's a lot of smart folks talking about how that's going to change, but I'll say from my end as a public health researcher, I fully expect that we're going to see shifts there in the next months to years.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.